Hello, my name is Dave Rakel. I'm the director of the University of Wisconsin Integrated Medicine Program, and here with Hagit Vardi, who's our Feldenkrais certified teacher, practitioner, and she's going to take us through how might she approach someone with low back pain.
Well, when someone comes with low back pain, I look at it as probably there is some kind of disorganization that doesn't necessarily start in the lower back. So as I'm going to work with this person, we're going to together discover what is easy for the person, where does the person feel that there are a disconnect between areas. And one thing that is very important when I approach it is that I don't go directly to the lower back. We start to see how areas that are good, that are healthy, are going to act even on a higher level of efficiency, of smoothness, and how before we even really change anything in the lower back, the person might feel much better.
Great. So we have Jake, visiting medical student here working with us, and he's going to be our patient, and we'll take people through it.
Okay, so just feel if there is equal distribution of weight between your 2 feet, or maybe there is 1 foot or 1 leg that you feel that takes a bit more weight than the other. And you can stare there, you don't have to look at me, just be with your body for a moment and just feel. Do you stand a bit more on the right foot, a bit more on the left, completely equal? And not sure is a perfectly good answer.
Yeah, a bit more on the left.
A bit more on the left. Okay. Okay. And so can you exaggerate it for a moment? Just come a bit even more to the left, and then come back to your neutral. And do that again. And come back to your neutral. And once more, and pay attention if you're going directly to the side, or are you going a bit more forward? And back to neutral. And now come to the side and a bit backwards, okay? Good. And back to neutral. Good. And stay there for a moment and notice yourself again. And see if anything changed.
Yeah, it does. It feels a little bit more equal.
More equal. So we exaggerated your idiosyncrasy, and now you feel a bit more equal. So that's just another idea about how, if you just pay attention and do things with awareness, things change for you just by asking the question. We don't have to direct you to, oh, you have to be a bit more on your right. Just doing 4 movements of emphasizing or exaggerating your idiosyncrasy already change how you are. So that's the idea that I'm talking about when I talk about setting just the conditions for the person to realize things on their own, to learn on their own. Okay? So I'd like you to put your right arm on top of your left arm, okay, and do a very, very small movement of making the right arm look as though it's a bit longer than the left one, and then you come back to your neutral. Okay, small movement, lazy movement, good. And as you do the movement, you're going forward and then you go back. And as you do the movement, just feel what is moving as you do the movement. What part of your body is right now doing the movement. Good. And the next time you come back to neutral, go slightly beyond neutral. So you go to neutral and then you take the arm backwards and it's still straight. And then you go forward. And notice now if there are many new areas, you go forward and backwards. And then do a movement that will make it look as though that your right knee is is just a bit longer than your left knee, okay? See if you can do it even a bit more lazily, okay? So that you don't lift this part of your leg, good. And you can start with really, really small movement. You know what? First just imagine that you're taking your knee slightly in front of your left knee, okay? Slightly forward. Just imagine. So you imagine that you take it forward, and then you imagine that you bring it back to neutral. Okay, so now actually do the movement. So you bring the leg slightly forward, and the foot is completely free and relaxed and not moving. Just pulled if it is pulled, good. And maybe you feel more areas that are part of this movement now. Good, good, okay. Next time you come back to neutral, you go slightly beyond neutral and you take, beautiful. And you go forward and backwards. That's nice. Good. Now when you go forward, let your belly be completely free. Completely free. Okay. So put your arms in the same configuration that you had them before, one on top of the other. And now combine the two movements. So you go with your right arm forward and the right leg. Beautiful. And then you go back and you can go beyond neutral, that's nice, and you go forward and back, good. So the next time you go with your arm forward, you keep your leg backwards, okay? So you go with your arm forward, good, and you keep, that's beautiful. And you go with your leg forward, at the same time you bring the arm backwards and breathe, good. And you go back and forth, that's nice. And let your abdomen be completely free, and the arm is straight, and you bring the leg backwards. And come back to neutral and rest for a moment. So feel again how you stand right now, if there is a difference from before.
It feels even.
Feels completely even?
It does.
Good. Any other place that you feel some differences? They can be very minute, don't have to be significant, just sensation in the body.
Yeah, I feel real connected to my spine on my right side.
On your right side.
On my upper, and my arm.
Good, good. So at home, maybe you can do the other side.
So that was an example of how you might approach low back pain. What I was impressed with there was how unique this is to the individual, that you work with the patient's body and you move them based on their unique structural identity.
Yeah, and it's almost not my moving them. It's almost like a dance. It's almost figuring out together where it's easy, where it's not so easy. And it allows the person to just figure out for themselves in a very organic way what they need. And it's all by sensing, not by thinking.
And in doing that, in enhancing that movement, we do create new neural networks in the brain that allow this to become the way they can be.
That's right. More of who they are.
Thank you, Hagit.
It's my pleasure. Thank you.